Hello, everybody. This is Dr. Cloe. How are we doing today? I hope everyone is doing fine. I want to start today by thanking God for His goodness and His mercy. For He's a good God and He always looks out for me. I know I'm so special in His eyes. I'm the daughter of the Most High God. I don't take that for granted, that He knows me and I know Him. So I'm doing a health tip today on cervical cancer. Normally I do them in pidgin so they can reach both the uneducated and the educated, our moms who are all over the world, because I have people that send them to villages and in our communities everywhere. So I don't want to do them in pidgin so that, everybody who can read or cannot write, can read, can write, can still understand what I'm doing, right? So we don't want to be selfish. So today I will do this health tips on cervical cancer. What's your cervix day? Your cervix day for that place, it day for the lower part of your uterus and your vagina. That place the piece now. Okay. So what did it cause this cervical cancer? Because why I want to do this health on cervical cancer because nothing way it dey right inside your body. With that cancer, they you just touch and feel them. Like the cancer is for your breast. If you feel your breast, if you touch and you'll feel them. So other parts of your body, for your neck, for your lymph nodes, if you feel them. For your lungs, they'll say, if you breathe fine. But for cervix, they're far, they're right inside. Then if you know whether you get that cancer or not until you don't start spread. So I want to give you symptoms the way if you get that cervical cancer, you go know. You understand? What did it cause cervical cancer? Now some infection they can say human papilloma virus. That virus they enter your skin through, which means through sexual intercourse when you sleep with man pikin. So when you sleep with man pikin, if your immune system be weak, that thing will sleep for the one they go to turn cancer. But the good with the cancer, I say if you prevent them. By the age of 13, all the way to 20 something, some vaccine they can say HPV vaccine. When you take that vaccine, it prevents that virus from finally spreading to cancer. So if you get young girl for your house, you get teenager them, small girl picking them, it's fine for go may they take that vaccine. Because you go help for prevent the cancer of the cervix. Wait, how this if you know say you get signs for this cervical cancer. When you don't sleep with your husband, because sex out of marriage for me, I don't believe him. So when you don't sleep with your husband, you don't get sexual intercourse with your husband. After that, you start getting with bleeding. You go to bleed unnecessarily. And then when you don't get your period finished, you want to see some bleeding go to the spot again. Where it don't make sense. Or after you don't go for menopause, like for 10 years or 5 years, don't go on day, you will just bleed. When you don't finish your menopause, once again, wake up one day, you start the bleed 6 days, 7 days. I beg, go check her, go see a doctor. May they check her, may they go inside, they go check, take some samples and see what it be wrong. Secondly, menstrual bleeding will be very heavy and will last long. Now a call for concern. We don't say fibroid do your own. But for cervical cancer, it do your own too, they're different. When you start the bleed, they be very heavy. And they last for long. Bleed for 2 weeks, something be wrong. So unusual bleeding, the way you don't bleed. You reach for some age, you don't bleed that way. Because if you don't get heavy bleeding, you feel understand. But as a young girl, 16, 17, 18, 19, 20, you never get some unusual bleeding. You want to go Sunday, you start the bleeding heavy for 2 weeks, you need to stop. I beg, go see a doctor, it'll be very important. Then, you get discharge for your vagina. That discharge, it is thick and it is smell. If you start get some kind of discharge for your vagina where it is smell, get odor. You go for take shower, you take your underwear, you see some heavy, terrible discharges for the way they smell. Go make doctor check you. Or you just get some unnecessary vaginal discharges the way it be bloody. where it be blood, it be stained with blood. You get discharge where no woman normally get discharge where if it be whitish. But if you get this discharge where it be stained with blood and the discharge is just heavy some kind of way, go check them. And cervical cancer, if they show your head so. And then you just woke up so. You just get some odor. You just get some odor. You want to go wash. Or you just woke up one time, wash your skin to the smell. I be go check them. Go check them. You know, focus over go eat yourself, you start get some unnecessary odor. Something be wrong for inside there. That odor, now call for concern. That heavy discharge will be color, be stained with blood. Now call for concern. That bleeding from nowhere. After you don't go menopause. Like for that kind of 5, 6, you won't cause on days, some bleeding just come over there, 7 days bleeding straight. Now call for concern. After you don't get sexual intercourse with your husband, you sure again want to see some bleeding just come out from nowhere. Some kind of pain. We need to understand the pain. We not going to get that pain. Go check her. Cervical cancer, don't start to show your head. If you get pain for your pelvis, you know your pelvis, no. Pelvis, when I feel you carry pikin, with the heavy so. If you start get pain for your pelvis, or from nowhere, or you see your man, one hear the pelvis, the hot, go check him. That cervical cancer, don't start to show your head. Just go when they do screening for you. That screen no hurt you. But it be very important. Say when you go check that pain. Then this thing what the name of one. So it be very important. It be very simple. They be very important because many women they get this cervical cancer. They feel that some big shame because when the cancer system hit, you did bleed unnecessarily. You just had the bleed everywhere. When they don't spread, that bleed is the biggest sign. Woman will just bleed. Oh, I beg una. If una don't start to get some signs, then go check them. If you know better that HPV vaccine, go take the HPV vaccine. If you get small girl picking them, go make them give them because when that cancer hit, it'll be very terrible. Now, what is the risk factor? What will put you at risk? What will make you be vulnerable? You feel easily catch the cancer. The first thing I want is smoking. Or for them, how supposed to smoke. Honestly, secondhand smoke. Now the same thing the man with the smoke. If I dey corner you with the smoke, guess what? Even though I no smoke, that smoke will do damage on my skin. So person with the smoke, it get big problem because if it easily catch that cancer. So if you do a person with the smoke, always stay away from he. If you start smoke, come on you for the environment. Not shut down there because you need the smoke. You answer that person, die the follow you will share a corner. You also get big problem. Run you when you start smoke. Go far away or make the person with the smoke go far. Not because of familiarity or because of love. You should make some person the smoke for your phone, the pump am. You just swallow and just say you be free. You also they are risk for get cancer. Corner by the smoke. Guess what? If you get multiple sexual partners, you there at risk for cervical cancer because you know saying that some virus where you cannot through sexual intercourse it cause the cervical cancer. So if you sleep with number 1, number 2, number 3, one man begin to work at the try man begin to say the try are close or say you test a granite, you there at risk for getting that cervical cancer. Maintain one sexual partner. As you married, maintain your man. Don't go outside because when you go outside, if you carry cervical cancer. Maintain one sexual partner. Okay? Now, man will start sex very early, is there a risk for this cervical cancer? Did you answer some man don't at the age of 9 don't want pikin, at the age of 10, or all the pikin the way this man they rape him. You require a daughter for go stay with some person, like family member woke up rape 7-year-old girl, rape 8-year-old girl, rape 9-year-old girl. When I don't say they do damage to that pikin, when I openly at risk for cervical cancer. Now what I'll make a head tip on, be careful you take a girl pikin the girl for your family member. And not one your brother, your cousin, your uncle. Not take your girl pikin, girl for family member, I may stay with you. Because that pikin be open to sexual intercourse. To devour that pikin for early age, they go be at risk for cervical cancer. It be very important. Say what see, all we will be very careful. Who will open with those two and who will take a girl pikin for girl may stay with you because When they start sleep with that girl pikin at the age of 5, 6, 7, 8, 9, 10, they don't open other pikin for waiting cervical cancer. So if mommy girl, you get girl pikin, not because of poverty, because you want me that pikin go stay for say abroad that you can't get for day, my dear. That pikin they will devour them. They will go sleep with that pikin, rape them every day, and that pikin no know say no even know for tell you because you go the fear say if you talk no man will believe you. So and they open you up for cervical cancer. So woman them wanna be very careful. Even by them. Don't begin to get pikin again anyhow. Even boy pikin for anyhow for anybody. Outside don't strong. Outside not be like it used to be again. So be very careful. A weak immune system. When they say when they chop vegetables them, they chop a fruit. When I stop this pork, all the meat they will chop them because it's the weaken your immune system. When you get when that virus don't enter your skin, if your immune system be very weak, guess what it? It go spread, start spread. Once see cancer of the bone, cancer of it go start to go breast, it go start to go everywhere, blood. But if your immune system is strong, it go fight that virus from causing a tumor, from destroying the cells. It go just have this build for your system like tumor. So that go be cancerous tumor because your immune system already be weak. You understand? Chop fine, chop vegetables, begin to exercise, begin to do movement then. Tell me your immune system is very strong. That's the way you feed the body, no. That's how the body will carry when age. The way you take care of your body, that's how you carry when you don't age. If sometimes you see people the way they be 50, they don't be 1 hour beat down because of what they take care of their skin. They chop anyhow, drink anyhow, don't do anyhow with their skin. You must maintain the body way God give you because the body no get duplicate. Take care of your body so you will be fresh and shine. Now how you take care of your body and also maintain a good heart. This heart so it will help you for they fine. When your immune system they fine. When your heart be full of wickedness, your immune system too they be broken. Now you hear me now? Okay. What will also help for promote this cervical cancer? You remember say sometimes the day way they will say me you take some medication for prevent miscarriage. No. That medication you take or prevent that miscarriage so it go cause cancer for that pikin within inside her belly. Even though you want to prevent that miscarriage, that medication, if you woman will take that medication for prevent miscarriage, when you born there get pikin, then you go take that HPV vaccine for prevent cervical cancer. Be very, very important. Now, when that cancer, if you don't find this spread, what you need to do, go for your doctor. First thing they will do is say they will take cells, then they will take your cells and go check and see whether the cancer, that tumor they don't see for your cervix, you don't turn to cancer. You don't turn to cancer, start doing your treatment. You will take chemo. But even as you do that chemo or radiation, begin to chop healthy and the terminal. Do you have cells for your body now? As that chemo, they wipe all the cells of your skin. If you eat healthy, it will rebuild itself very well, very quickly. But even as you do that chemo, so if you get strong immune system, you know it will knock you down quick. But anyway, they don't go take cancer treatment. It's the end of a die. Because as that cancer treatment they enter, they wipe out of your skin. But if you get that strong immune system, it will be rebuilt very fast. You know it will destroy your skin very, very fast. How if you prevent this cervical cancer? Always go for the pap smear. That pap smear, when you go for your doctor, they take some liquid for your, they send some machine, take some liquid for that cervix, no, for your vagina. When they take that pap, they will put them for, for lab, for check out, see whether you get any cells in where they also produce any cancer producing cells there. When they catch them early, it be very important. When they catch them early, they feel easily, give treatment, it will help you. Prevent safe sex. No begin to smoke or strong with the smoke. Now for prevent the cervical cancer. Make sure say you get there where they born them when they start for that vaccination age, when they take that HPV vaccine, it will help for prevent the cervical cancer. Also, I don't give some information where it will help you for identify the signs and symptoms of cervical cancer. God bless una. I not take off una help. I not take una help joke because cervical cancer is one of the worst cancer I don't see. So I come today for do health tips on cervical cancer. I hope so when I will subscribe, and also when I will send this the health tips them far and near, make other people learn the signs of cervical cancer. God bless you, Nana, Dr. Cloe. Till again. Bye.